It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
Are you somebody that's got brown spots in your eyes? Maybe your eyes are almost bloodshot all the time. Maybe you have some yellow spots. Well, board-certified ophthalmologist Dr. James Kelly has pioneered what's called Brite White to help many of us have brighter, clearer eyes. And we're going to talk about how we can get that done for you and really change your life. Dr. Kelly, thanks for being with us.
Thank you for having me, Steve. I appreciate it.
So Brite White, explain exactly what Brite White does.
So the procedure works. Well, first of all, what we do with our patients is we have a thorough consultation with them in the office. We go through a series of questions about their eye health and their general health. Sometimes we'll actually refer a patient to other specialists to look for, let's say, something going on with their thyroid, or maybe they have something going on with another part of their body. So depending on the reason why I believe their eyes may be discolored, we will involve other specialists in the overall workup of the patient. But for the majority of people, they come in with these red or yellow discolored spots, and they're very characteristic of people that have sun damage. So it could be from people that grew up in tropical climates, in the Middle East and South America, Central America, parts of Asia, Africa, where they live closer to the equator. The ultraviolet radiation from the sun is stronger. Many of them have spent a lot of their youth outdoors, and unfortunately, sometimes without sunglasses. And so the sun, the actual ultraviolet radiation from the sun, damages the surface of the eye and thickens it and discolors it. And they wind up in my office. New York City is the melting pot of the world. So we see people from all over the world, and it's a pleasure to be able to help a lot of them.
If somebody's been told that they have, I think it's called a pterygium, is this what that is? And does Brite White help that?
Yes. So the most common reason why people come into my office with discolored eyes is because of something called a pterygium. And what that essentially is, I'll get your coffee if you spell it correctly the first time. A little tricky to spell.
Yeah, I'll do that after I put my glasses on. No, I'm just kidding.
So this pterygium is basically thick, discolored skin from many years of sun exposure. We'll even see it with people who spend a lot of time on the water, or actually people who are in snowy mountainous environments who don't wear sunglasses. So that's another way that they can get this pterygium. But in any case, the pterygiums grow over time. And even if a person's outside the sun and they've moved to an area where they're not exposed to the sun a lot, the pterygium can continue to be irritating to them and disfiguring to them. And a lot of times they'll describe a foreign body sensation, like there's something in their eye. They often will, just be bothered by it. And they'll tell me things like, my friends or my coworkers think I'm using drugs. They think I'm smoking, I'm staying up late.
I'm hungover.
Yeah, they start to worry about how others think about their lifestyle, and we want to do our part to help these patients in every way possible.
Now, it's great that you pioneered the procedure, Brite White. How long does it actually take?
So the procedure in my hands for the average patient that comes to me is about 20 to 30 minutes. I do one eye at a time, and I make sure I watch for the recuperation of the first eye, make sure it's healed. We put patients on drops afterwards. We put them on antibiotic drops and anti-inflammatory drops. And I follow them very closely in the office so that we monitor the recuperation. Once they're fully recuperated from the first eye, and in many cases, patients have this problem in both eyes, and I'll do that same procedure on the second eye. And so they like I said before, it takes 20 to 30 minutes in the operating room. It's done under local anesthesia. So there's no needles, there's no injections, and the local anesthesia, which is basically in the form of eye drops mostly, keeps their eye anesthetized. I'm talking to the patient during the procedure, so they're very comfortable during the process.
What about recovery? How long does it take?
So the recovery takes a while. It's about 6 to 8 weeks to fully recover. Their eye is generally, believe it or not, a little more red initially for the first couple of weeks, and then that redness subsides as the inflammation subsides. But for the full recovery, it takes about 6 to 8 weeks. What's interesting, I always operate on the eye that's more symptomatic first. The eye that's more red, more discolored, and when I'm done with the procedure and the patient's done with all the recuperation, let's say at the 2-month mark, they'll often say their eye is brighter and whiter than it ever was before they had the pterygium. So they said, I've never seen my eye this bright and this white. And they look enthusiastically towards getting the second eye done.
Wow. It's almost like teeth whitening for your eye in some regards, right?
Yeah, absolutely. And you'd be really surprised how many people are bothered by, psychologically affected by discolored eyes.
Well, every time you look in the mirror, just to the point that we made before, how you're being perceived by people. They wonder what's wrong with you. And there's nothing. I spend some time in the sun and this is the way I look. And what's the first step? They make a consultation and where do you go from there?
So we will do if they're a person who can get to either our New York City or Long Island office, we'll do the consultation in person. If they can, we'll do a Zoom consultation. So we are able to get patients from far distances from where our offices are located to still become eligible candidates for this. So I'll do a Zoom consultation with them, and then I'll have them submit high quality photos of their eyes, and we'll review them. And then if they seem to be eligible, we'll have them come in person, and they will then make a procedure date. And usually we try to do it as soon as possible so that we could have the least interference in their lifestyle. And I tell patients after this procedure, they can resume their normal activities the next day. We ask that they do wear sunglasses and use their drops that we prescribe, but they can drive the next day. They can watch TV. They could use a computer. They could use their cell phone. They could exercise. So again, it's easy to introduce into their lifestyle. I caution them that their eyes will be red for the first few weeks and not to be alarmed by that, but that will gradually go away and they will have brighter, whiter eyes at the conclusion of their recuperation.
It's amazing. I'm sure so many patients that have had Brite White done, look back and say, why didn't I do this sooner? This is right.
Absolutely. Yeah. It enhances their lifestyle, their sense of well-being. And it is something that, a lot of people are afraid to have surgery on any part of their body, let alone their eyes. And they just put it off for multiple different reasons. But I'm happy that some people get to me and we're able to help them.
I'm glad you pioneered it for a lot of people. It's relatively painless. Brite White, and I am working on it right now, the spelling of pterygium.
Okay, so no Googling it now.
How many vowels? No, we'll figure that out later. Thanks for being with us, Dr. Kelly.
Thank you so much, Steve.
It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
Learn more at kellylaser.com.